This podcast I have chosen is an American Medical Association production analyzing social determinants of health and improving access to care. The subject of the interview, Ketal Patel, CEO of Virginia Mason Franciscan Health, known as VMFH, the president of Northwest Region of Common Spirit in Seattle, discusses his efforts to address healthcare disparities. Awakened by a journey through Nepal with his parents, Ketul is aware of the importance of socioeconomic factors in healthcare, such as economic factors and physical environment. Among the actions of Patel and the VMFH is providing community health improvement grants. In the last year, the organization spent $1.4 million to support the community's challenges. Patel has also created a Federal Way Youth Action Team to address violence in BIPOC communities, providing over 400 young men and women services focused on domestic violence, domestic trafficking, mentoring, and education. He believes that targeting the underprivileged in their communities will facilitate greater healthcare equity. Social determinants are non-medical factors affecting health outcomes, such as access to health insurance, socioeconomic factors, living and working conditions, geographic isolation, and access to healthy food. Alleviating healthcare disparity means overcoming obstacles outside of the realm of healthcare. Patel and his organizations are acting to overcome these obstacles by addressing social determinants. According to the CDC, SDOH facilitates health equity, a state at which everyone can achieve their highest level of health. Studies show that SDOH influences health outcomes more than genetic factors. Poverty and the effects of racism indicate poor health and a higher risk of premature death, making SDOH a significant factor in communities of color. Patel and his organizations reach out to these marginalized communities to counter the effect of SDOH. This relates to the classes unit study on cultural proficiency. Culture is another social determinant that healthcare workers need to address by responding respectfully to people of all cultures, classes, races, ages, sexual orientations, and ethnic backgrounds. Healthcare workers can take steps toward overcoming health inequity. Equity in healthcare is not something that can be treated in a hospital. To make difference, health professionals need to move beyond their spheres and reach out to the community. Patel and his team recognize the importance of focusing on the whole person, not just their illnesses. People like Patel and his team go above and beyond their call of duty, their mission to end health inequity. Sociodeterminants, one of the modern healthcare top diversity leader, preventing violence, BIPOC community, Federal Way Youth Action Team. And here are the sources, by the way. The end.